Should scars be visible after surgical procedures on the face, or can they be made more difficult to see or virtually invisible? So this is a lady who came to see me, and she'd have a previous blepharoplasty, previous face and neck lift surgery with a local plastic surgeon, and she was unhappy because she'd got resulting asymmetry, visible scars, unevenness, and she still had quite a tired appearance. Like, bearing in mind she had upper and lower eyelid surgery, her eyes are quite tired, there's loose skin, there's puffiness from fat, and there's quite a lot of facial aging in the center part of her face. We can see here there's a white scar in this area of the eyelid, and in a way, with eyelid surgery and upper blepharoplasty, well, often it's necessary to take some loose skin from the eyelid, but really as a preference, we'd want to put the scar lower so it's in the natural crease of the eyelid. This scar is a bit too high, which means it's visible and it catches the light. And on the other side, there's this puffiness, and this puffiness is fat that's creeping forward. It gives a white discoloration to the skin, and similarly there's some like puffiness in the lower eyelid that is despite having lower eyelid surgery. And also we can see the lower eyelid, it's actually pulled downwards, and so this is called eyelid retraction. Although this is mild, it has resulted in a subtle change in the shape of her natural eyelid, as there's too much skin that's been taken away, and so this is pulling downwards. Well, this is taken from a book that I wrote on blepharoplasty for patients. And I give this to all my patients who are considering eyelid surgery because it gives them enables them to have a fully informed decision about the procedure, and gives you a lot of information about key aspects of healing and recovery. So in terms of this puffiness in this area, well, this really correlates to this fat. So this fat in this area is creating a slight white discoloration. And ideally, what we want to do is reduce that with eyelid surgery. The crease in the eyelid we can see is this kind of line, and you can really see the natural crease when you close your eyes. So if you're able to take a photograph when you close your eyes, you can see this. Everyone has a natural crease in this eyelid, bar certain ethnicities. And ideally we want to hide the scar in that natural crease, and that will make the scar virtually invisible. So in this patient, well, the scar is too high up, like in this area. It should be much lower down, and there's too much puffiness because there has not been any reduction in the orbital fat. And this has created like a A-shaped deformity because there's less skin in this area and then there's more skin in this area. So there needs to be a little bit more accuracy in the detail in order to give a more natural rejuvenation here. And of course the eyelids in this area are thin. Everything in this area, the anatomy is delicate and fine, and millimeters make the difference. And now I would think that the surgeon who did this, a general plastic surgeon, probably didn't mark the natural crease before doing the eyelid surgery, which generally can be a good idea because if the crease is marked, it means you can avoid these kind of issues. Sometimes just marking the shape of the eyelids can take 10 minutes even before the surgery. In terms of the anatomy in this area, well, this area and this area here have this orbital fat, and what we can do with upper blepharoplasty or revision upper blepharoplasty is we can just reduce the volume in this area, reduce some of this yellow puffy fat, and that will give a smoother, more rejuvenated appearance. So this is the same patient after I completed revision upper and lower blepharoplasty with laser resurfacing, fat transfer, and the use of regenerative medicine. In the upper eyelid, what I did was I reduced the position of the scar, so I put the scar lower, so it's actually in the natural skin crease, so you can't see it with this lady opening her eye. And in addition, I reduced the puffiness in this area, reduced the fat to make this area more concave, and made the eyelid more even, so you see an even amount of the eyelid all the way across. In the lower eyelid, well, I reduced this puffiness, which was orbital fat creeping forwards. I completed fat transfer in this area, which means taking a little bit of fat from around the belly button, concentrating that fat, and then just putting a small amount in this area. It just makes this area smoother. And in patients with mild eyelid retraction where the eyelid is pulling down, it will just support the lower eyelid and lift it higher. She still had these lines in the center of the face, and sometimes these are called nasolabial lines and these ones are called marionette lines. And with conventional facelift or SMAS lifting, the part that's really lifted is in front of the ear. So this area of the face often after SMAS facelifting is pretty much the same as it was before. And we can see there wasn't much of an improvement in her jawline and her neck because most of the surgery was in an area that didn't make enough of a difference in this area. And she had like quite visible scars that were noticeable on both sides. And this is because the scar was in front of the ear, which meant that it catches the light. And ideally we want the scars to be along the natural contours of the ear, and that will make them far more difficult to see. And in some people they are virtually invisible, but that is also based on your genetics. What can we do that will make a real difference to this part of the face that's aged? Well, there's really two things. One thing is everything's dropped down with gravity, and so if we lift everything up, it will restore the anatomy to where it used to be when she was younger. And that means releasing all the natural ligaments in this area. And the only way to do that without making visible scars is a vertical deep plane facelift. And that means hiding the scar around the curves of the ears, but coming in a natural plane of anatomy to this area here, releasing those natural kind of ligaments so that the face can be lifted up and rejuvenated. The second thing that I would suggest in someone who's lost some volume, and that can be determined by looking at an old photograph, is adding some more volume, such as fat transfer. And fat transfer will restore some of that volume. So we can see in the after photograph, well, these lines are much softer. She's just got like a smoother contour to her face, and she looks far more refreshed. She doesn't have the same lines, shadows, wrinkles. The nasolabial marionette lines are all improved. And this is really a combination treatment of my signature deep plane vertical facelift with some fat transfer and revision blepharoplasty to give her the best results. In terms of the scars, well, the green is where we want to hide the scars. In this lady, the scar was more in the red area. The red area means you can see a visible scar in this area. Sometimes if the red scar is too low in the hair, you can see a visible scar behind the ear. And if it's lifted in a certain area, it can lift the temporal hair, which can also result in an unsatisfactory result. My preference is to put the scar on the natural curves of the ear, hide it behind the ear and in the hair, and that makes it much more difficult to see. And also we can do something called a beveled incision, and that means the scar is just within the hair and it's angled. And that means although when the scar is first seen, it will be at the very edge of the hair, as the scar matures, hairs will actually grow through the scar, making it more and more difficult to see with time. So after the facelift surgery, well, her scars were more hidden around the natural creases. They were difficult to see. Her jawline, her neck was made better, but critically, the center part of the face that really aged her was really rejuvenated and she looked a lot fresher. So in summary, with face and neck lift surgery and blepharoplasty, it is possible to hide a patient's scars, but a lot of care is required in the detail to hide the scars in the natural creases, the natural curves, and that takes more time to do and it's more delicate and precisionate, but it does mean that those scars are much harder to see with time. I do hope this information has been useful for you. If you have any questions about anything I've discussed, please don't hesitate to contact me. How to avoid visible scars? Well, you do need to complete some research and look at your doctor that you're considering seeing. Look at someone who specializes in this face, so they're conducting this kind of surgery every day for their patients. And really, facial surgery is surgery of millimeters, whereas other surgeries of the body can be more surgery of centimeters. Eyelid surgery is really surgery of millimeters, not centimeters. It's very important that we hide scars in natural creases and natural curves, and this requires a relatively meticulous attention to detail. A deep plane facelift, well, it's more effective in improving the center part of your face. However, it does take more time because it relies on releasing these ligaments that are like glue in the center of the face. It will give a natural lift. It often gives faster recovery in terms of reduced swelling and bruising. And my signature deep plane facelift often restores previous patients who've been unsatisfactory from facelift surgery. I specialize only in the face. I have done fellowships in the US as well as London, and I specialize really in natural looking results and fast recovery, and I have my own signature vertical deep plane facelift. Please like this post and subscribe, and send me a question if you would like anything specific answered. Thank you for watching.